Okay, you are live.
Hi. Well, hello. Thank you for coming today. I'm a classical homeopath. My name is Dianna, and I had a lovely presentation to share with you today. But I will just read and chat and answer questions as we go. Does anybody know what classical homeopathy is here? I get that a lot. Maybe I've used arnica, things like that. Father, would you like to say a prayer to start?
No,
we're just going to go straight
we're all ready.
in? We're in. Okay. So, in the history of health and medicine, we have vitalism and we have mechanism. And so, way back when, in ancient Greece, we did have some medicine that was more whole body. But as humans progressed, we have this idea that, you have something wrong with one part of your body, so we're going to just fix that, right? And you hear that all the time. I have a pain in my back or my hip, and we go to an orthopedic, and they're looking at that one part. They'll do an MRI. It's just that one part. Vitalism is this idea that we are treating the mind, the body, even the soul. We have psychospiritual ailments. Sometimes we have a grief, a trauma, something happens. I have a client with epilepsy, and there's nothing on the MRI to show why he has it. There's just nothing there. But when he had this symptom, he was going through a hard time. He had trouble with his income and his marriage, and his mother had died. And when he came to see me, he said, nobody ever asked me that. So how do we lose our balance, and how do we work on the whole body? So what makes us human? I'll open it up to you. What makes us human?
Well, there's the prevailing thought that sentience makes us human. And so self-awareness and awareness of others.
What else? We have our bodies.
The physical body.
We have our bodies. We have a soul. We have something that unites our body and our mind and our cognition and all of it. What makes us behave the way that we do? Why do we have, for example, 4 children growing up in one home, but they behave differently when they get upset or when they're happy? How can you have somebody, there's a car accident with 3 people, but they all have different ailments coming out of that same exact car accident? These are the things that we talk about when we talk about the vital force in homeopathy. There is something inside of us that governs our being. It governs our thoughts, it governs our emotions, it governs our body, it governs our symptoms. See, I had such a nice picture to show you. Why do we make symptoms? I don't know if you can see this at all, but we have stress. We have stressors. We have little things that are nudging us along the way. See, I even had a different picture here. In homeopathy, we get symptoms when we have stress. Okay, and what is stress? It is a teacher that yells at us. It is a boss who belittles us. It is a car accident. It's a virus. It's COVID. It could be the death of a mother. It doesn't matter. But every time we have stress, we are responding to it. And this is how we become who we are. So you talk to each other and people will say, I have arthritis. I have such anxiety, I cannot get out of bed. Somebody else shuts it all down and works to deal with their stress. And they become workaholics and they don't have a balance to their life. So here's the beginning of homeopathy. We're going to the time where vaccination came to be. Okay, similar idea that this tiny thing, this tiny medicine can build your immunity. And we saw it simultaneously, the collective unconscious, right? All through history, we see these things, these patterns emerging. So Samuel Hahnemann is the founder of homeopathy, who is a German a medical doctor, but he was mad at medicine, so he left. He didn't like leeching. He didn't like giving people high doses of arsenic and mercury, which was a treatment. And he didn't like that surgeons were not washing their hands. He knew they were dirty. So he actually left medicine. He was transcribing medical documents, and he came upon this article that said that cinchona, Peruvian bark, was a tonic for malaria, and he knew that was wrong. He knew it. So he took cinchona. That was our first proving of our first remedy. And as he took it, he developed symptoms of malaria. And here we come to what homeopathy means. Like cures like. We don't give somebody a remedy with exactly what they have. For example, if somebody has responded in a negative way to a vaccine, we're not going to give him a medicine made from that specific vaccine. That's isopathy. But we're going to find a remedy that has similar symptoms. So, in fact, when we take a homeopathic remedy, it has similar symptoms and it inspires our vital force, which is the talk today. We'll talk more about the vital force, to behave differently. And it can be curative. So this idea that if you have this terrible arthritic pain, and then you take a remedy with similar arthritic pain that is worse when you're not moving, worse in the morning, worse when you're sitting, and it responds to heat, or cold. When you take a remedy with similar symptoms, the symptoms in your body decrease over time. I don't think we have much medicine in our society that can do this in this way, because you, in fact, are healing yourself. The remedy is a catalyst. In a way, it's this little stressor, but I never know how people get better, what gets better first, because it is gentle and safe, and it is you doing that work. In 1922, Hahnemann published The Organon of Medicine, and this is how he summarizes what he does. The physician's highest calling, his only calling, is to make sick people healthy. To heal, as it is termed, the highest ideal of therapy is to restore health rapidly, gently, permanently, to remove and destroy the whole disease in the shortest, surest, least harmful way, according to clearly comprehensible principles. And so when my brother-in-law said, Diana, when you sent me them 2 little sugar pills, I thought you were crazy. That's what I did. I sent him 2 sugar pills. They're remedies. They're all on this little pellet, and all the different medicines are put on this this is what we hold it on. And he had pain in his legs that was stinging, buzzing, like a bee stinging him. And many homeopaths would have given him the remedy Apis mellifica, which is made from bee sting. But I learned a different way of practicing, where we're looking at the whole person, and we're looking at somebody's tendencies. We go back to childhood. And I gave him a different remedy, and it was gone 98%. Not with the first dose. We had to keep working together. But he saw relief from them 2 little sugar pills. So that is what we do. So what is the vital force? Hahnemann believed that each of us has a central essence that guides our lives and health. When the vital force becomes disorganized from stresses, our body produces symptoms that are the effects of the straining against the stressors in our life. So you've heard of Qi in Chinese medicine. In homeopathy, we use this term, vital force. Sometimes I call the vital force the God spark inside of us. God created us. There's something inside of us from Him, and how does it respond? So the correct homeopathic remedy, and there's only one that will work, which is why I ask so many questions in the intake. The correct homeopathic remedy reorganizes the mind, body, emotions to bring us closer to health over time. Any questions so far? Let's give a pause. Okay. My teacher, Paul Herskew, and his wife, Amy Rothenberg, they teach at the New England School of Homeopathy. They had never been online until COVID. And so I was able to take this course. he says 90% of homeopaths prescribe wrong. There's a tendency to still do that allopathic thing. Okay, these are the asthma remedies. These are the diarrhea remedies and things like that. So, but he said, no, it's not about. Sometimes people come for, I had a client come to see me for eczema, and there were some serious psychological issues we had to address first, so we just look at the whole body. Herskey developed a system of case analysis called cycle and segment approach. Instead of like grabbing on, oh, there's diarrhea and there's, oh my goodness, and then there's the asthma, and just trying to figure out which remedy is it. He developed this very scientific method of pulling together symptoms and grouping them. So when I see a client, we're grouping, I actually make a cycle on the client and we're grouping symptoms together. So for example, somebody who has a lot of tightness in the body and someone who suppresses their emotions probably also has constipation. Could be stingy sometimes, and we kind of put all of these things together in one segment. And then we see what comes before and what comes after, and in this way we're looking for patterns. I had a client come to me recently for wanting to just feel better overall, had some things, but there were things in the case history that were somewhat destructive. We had a very severe vaccine reaction with seizures. We had several miscarriages, and then we had heart issues. And so that's what I follow. What is the story and what is the path? And we have to find a remedy that is going to decrease that chance of destruction, of harming the body. So those are deeper pathological situations there. We have a cycle and a client, we match it to a cycle and a remedy, and then we begin to work together. So 10 people can have ADHD or bronchitis or asthma, and they will likely need 10 different remedies. So you'll hear, oh, homeopathy doesn't come out good in clinical studies. Double-blind clinical studies come out of homeopathy and the early work of homeopaths. Nobody knows that. But in fact, the studies are flawed from the beginning. They can't work because they are not, it's not like a pharmaceutical medicine where you're testing one inhaler to see how it affects people with asthma. Individuals have different symptoms even though they have the same diagnosis. And we have to look at those individual things. So some of the things we talk about are body temperature. Are you chilly or are you warm-blooded? Do you sweat? How many people sweat sitting down? Their feet sweat, they wake up sweaty. We look at temperament, we look at food cravings, we look at time of symptoms. Some people are worse. Some people wake up every day, 2 in the morning, and then they can't get back to sleep. We look at sidedness as well. We have left-sided remedies and right-sided remedies, and sometimes you'll hear some, oh, the headache is worse on the left side. Oh, my hip is worse on the left side, and my foot. And we just start to see these patterns. Miasmatic predispositions comes from the Greek word which means pollutions. We believe that we have not inherited the diseases of our predecessors, but the symptoms of their disease. You can have a child who becomes, is born, is healthy, is fine, and then everything goes in the lungs. Pneumonias, bronchitis, becomes asthma. Why? We believe that somewhere in that line of history, somebody probably had tuberculosis. We have to clear that tubercular miasm, and then they won't get those colds all the time. So we have a few different miasms. I'm going to skip this part. If you want to talk more about it, I can. We'll talk about that at the end. There's a homeopath, Ananda Zarin, who wrote a mental health materia medica. She was a home birth midwife who became a homeopath, and her remedies did not hold, and she didn't know why. And so she started to look at the emotional trauma. And what she found was that everyone has trauma, and then we put up a wall. And we wear a mask out in the world, right, to protect ourselves. We don't want to get hurt again. And she found when she aimed that remedy at the wall, it came down, and she saw curative effects. And so that is also part of my practice. we look for those little moments in childhood. Well, what did you do when your father was drunk and belittling you? Some people hide, some people get rebellious, different things, and that's in the remedy too. Constitutional homeopathy can be preventive. As the vital force reorganizes itself into a better state of health, when stresses come, they don't hit us as hard. And my moms are the best ones to tell me. They know when they need their remedy, when their children are irritating them a little bit more, because it calms things down for them. My teachers, Herskew and Rothenberg, who practiced for over 35 years, never saw a stage 4 cancer in their practice for thousands and thousands of patients. For children, we change their entire health history with the remedy. Parents don't know that. They bring the kid for recurring colds or behavioral issues, but they're reorganizing, they're getting so strong, and then as puberty hits, as they go out in the world, it's different. They just become more stable. We can heal some of this negative self-talk, some of this shame. We've got kids with cutting and people going through some really difficult things, and the remedy with other support as well. They have therapists and they have their other things they do. It just is amazing to watch it unfold. So who can benefit from classical homeopathy? I had a cute baby for you. So from pregnant women, babies. Did it flip? It did. Thank you. Plants. I haven't learned how to treat my plants yet. I'm working on it. To our elderly. It's just a great modality. With the kids, if you have somebody with autism or ADHD and they're doing OT and they've got some therapies, the therapist will notice the difference after the remedy. The therapies all of a sudden are clicking and working better. So we can't cure everything, and we'll talk more about that, but we are supporting the individual to be in better health. And then, they just respond better. I work with doctors on some plans. I send people for cancer screenings. I'm not an anti-vaxxer. We need it all. We really do. I wish we had more homeopathy in Western medicine, because outcomes are different. And I'll tell you some stories. So I am going to show you my pie chart, Ricky. So in Western medicine, you have an ailment and you get something for the ailment, right? Asthma, you get your inhaler. You've got terrible heartburn, you get your PPI. You've got high blood pressure, you get your medicine. You're depressed, you get your antidepressant. And it goes on like this. Do you know, Joanna, the average number of medicines people are in when they're 60?
Oh,
It's pretty.
it's a lot.
It's pretty high.
Yeah.
I think it's like.
There's at least, what I see on a regular basis, 20 plus.
You see 20 plus. I have clients on 20 plus meds also when they're intense diagnoses. And here in homeopathy, we have one remedy. And the one remedy will touch on all of these different things in time. And also, people stay on their meds. I'm not trying to talk ill of meds. It's just a different approach. So here are the pellets. This is it. People come to me and they get a few of these little pellets that I mail them. And they think it's odd, but they stay with me. And then they go, oh, how did this happen? What are the remedies made of? We have many remedies made from minerals, plants, and trees, but we also have bee stings and snake venom remedies. So most of our remedies, they come from the natural world. I'm going to skip my little vital force meditation. We can come back to that too. So who are my clients? I've got children with recurring infections or behavioral challenges. And I've had moms weeping with me. I don't know why. Why did my kid do this? And I always tell them, your kid's a good kid. And your kid is just doing the best he or she can in that moment. And then we unravel it. We do need to look at the why. Why are children behaving in the way that they do? I've had kids come to me who've been to Children's Hospital with stomach issues and GI issues and pain, and there's no diagnosis. Usually that is cleared up after a couple doses of a remedy. Adolescents and teens, acne, headaches, stomach aches, anxiety, depression, suicidal ideation, behavioral challenges, including substance abuse, defiance, and truancy. Adults with menstrual challenges, including cramps, excessive bleeding, and mood swings. I had a case of, is it PMDD, the premenstrual disorder? It's gone. The woman was hospitalized on lots of meds and nothing was helping. Her quality of life has improved. Perimenopausal women, they love me. Menopausal women, cognitive decline, sleeplessness, hot flashes, and lots of sweating. And I say that because they can sleep again, you know, and homeopathy helps us land into menopause. People of all ages, long COVID, chronic fatigue, joint pain, migraines, homeopathy works so well to support people with those symptoms. Elderly with cognitive decline, the earlier the better there. Rheumatoid arthritis and other joint pains, dizziness and vertigo, blood clots, skin disorders. So I have a client with psoriasis. It was terrible for years and it's almost gone. Nerve pain and neurological symptoms such as burning pain, trembling, and numbness. I had a client who is a devout Catholic and she came to me. She was waiting for another disease actually. She had blood clots after COVID. She had rheumatoid arthritis. She had lupus. And she came to me and she said, you know, if this doesn't work, God will show me where to go, where else to go. And I said, well, why won't it work? Why wouldn't it work? Because she had despair of recovery. She was waiting for another disease because these things kept coming and her quality of life was decreasing. She had fatigue. She couldn't do what she used to do. And in 5 months together, her blood clots are gone and the lupus and RA are not detectable on her blood work. You know, and she says, I can't believe it. And she's doing things. She's doing things with her husband that she couldn't do before. Let's see. So chronic disorders, multiple sclerosis, epilepsy, TBIs, oncology support, blood clots. I've got some atypical tuberculosis clients doing great. It's not cured. It's not worse. It's under control. Autism spectrum disorder, ADHD, and ADD. So we can't cure everything in homeopathy. And if a homeopath tells you that, we should question them. But we can decrease symptoms and we can prevent. So my clients with multiple sclerosis have no new brain lesions since they've been working with me. My client with epilepsy still has epilepsy, but instead of 2 seizures a month, he's gone 70 days one time. It's still, you know, still in flux. We'll see where he lands. And in terms of oncology support, I do not treat cancer patients, but homeopathy can help decrease symptoms of chemo, radiation. We can help with a lot of that stuff. And I've seen great outcomes. You know, I've just seen people with cancer who have that remedy do really well with treatment. So emotional symptoms also. People come to me just for emotional symptoms, panic disorders, grief, suppressed emotions, lack of boundaries, procrastination, low self-worth and negative self-talk, chronic helping of others until the client isn't even in the story of her life, fears, anxiety, jealousy, suspicion, restlessness, lack of focus, resentment, and brooding. We have remedies for that too. Homeopathy takes time and communication, so not everyone is a good fit for me in terms of a client. I need a client who's going to answer my texts because I stay with them. I need to know the remedy is the right one. We know by week 3. And they need to be willing to do this work. It's intense to talk about your childhood. This is a very intense relationship. It's a very intimate relationship with a homeopath. And I hope I welcome everyone and meet them where they are. People will say, oh, I can't talk about politics. And I say, you can't offend me. You just be who you are. And then they can share and open up and feel that trust that I'm there to take care of them. Many clients within 6 months are in a different state of health. I had an 8-year-old with many fears. She couldn't be on the floor of her bedroom by herself, very attached to her mother. She just flew to Phoenix by herself, maybe. Yeah, I think it was Phoenix. I have a TBI client who had a TBI for 30 years. The symptoms are completely gone, and he has this renewed sense of life. He's healthy. He's enjoying his family. And look, I even had a picture of a pear with a Saint Seraphim quote. He said, whatever you do, do it gently and unhurriedly, because virtue is not a pear to be eaten in one bite. And homeopathy is this gentle, gentle medicine. Miranda Castro, a homeopath in Florida, she calls our cell salts gentle little souls. And people will say, is there going to be a side effect? No, there's not a side effect. It's just this gentle way of you healing yourself. Homeopathy in sync with other modalities. So my practice is based on a deep respect for cancer screenings, vaccinations, one at a time please, surgery, oncology support, and other modalities of Western medicine. In addition, I encourage clients to eat a healthy diet and exercise. I often send clients to Megan McGee, who's going to be speaking here at 2 today. She's fabulous. She's been working with me with SIBO, and she and I have a great relationship with clients who have gut dysbiosis as well. I often refer clients to a Thai massage therapist, Melissa Chapin, who's in Wheat Ridge. And I send people out. If they need to see a medical doctor, I send them, you know. It's very important that we do all of these screenings and that we have good relationships with our providers. So here, I am not a doctor. I do not diagnose or treat diseases. Homeopathy cannot address all health issues on its own. In some ways, I am a homeopathic educator, teaching my clients about their vital force and how to support themselves with the daily stressors that they face. Homeopathic remedies can often take away symptoms. Sometimes homeopathy decreases symptoms. When you take the right remedy, you are getting stronger and are preventing declines in health and even potentially diseases. We can't quantify that, but I think we had 7 negative biopsies in my practice, which I'm delighted about. Homeopathy cannot cure many of our life-threatening illnesses, but it can decrease the intensity of the illness and the symptoms and move us closer to health. I have one more quote from Saint Seraphim of Sarov. You cannot be too gentle, too kind. Shun even to appear harsh in your treatment of each other. Joy, radiant joy, streams from the face of one who gives and kindles joy in the heart of one who receives. And it is my great joy to be a homeopath. I love what I do. Any questions? Yes?
Would you talk about the mucosal immunization?
What I learned in school, I don't think you're going to like it. Yeah, what do they call it? The prophylaxis, homeopathic prophylaxis. The research is not there as it is with vaccinations. So I don't practice that in my practice. I haven't learned it. Yeah. But I do know people who do. So I do think it works for some people, but the rate of prevention for disease is much lower than with vaccination. Did I answer? Yeah. I know, and within homeopathy, you have people who do different things and treat differently also. I just know what I learned from Herskue and Rothenberg. Yes?
Earlier you mentioned isopathy, which is like taking the exact same thing in a small. What is the difference in practice of using isopathy versus what you were doing?
I don't use isopathy at all. It doesn't. What I understand is it doesn't really work. We think it could work, but it doesn't. But again, there are practitioners who practice isopathy. We took a case at school of a woman who had a horrible response to one of the COVID vaccines. I can't remember which one. And so she had been to a homeopath who was giving her a homeopathic remedy made from that vaccination, and it was not helping her. And in fact, if you take the wrong remedy, it can do damage. It can give you new symptoms. And so I just have this very careful way of working with my clients. And again, other people practice it. I don't really know the long-term way it works, but homeopathy is that like cures the like. And that's what we see in practice, that's what we see. And my brother-in-law is the example. I really think most people, he was using the language of that remedy. It's buzzy, it's burning, and I was like, nope, I'm not gonna do it because this is what I learned in school. And it may have helped a little, but it would not have had a lasting curative effect, if I had given him the APIS.
So do you know where that came from?
I don't, no. No, I think, there are people who give everyone all the no-sos. They're like, oh, we all have these miasms. We have visceric miasm, which was the first one, which is skin illnesses and eruptions, I should say. And then, well, we should give everyone the one from gonorrhea, and we should give everyone, the remedy for the tubercular miasm. But the symptoms don't go away. And I think when we get to those formulaic ways of prescribing and of using homeopathy, then it's just, I don't know. It takes away from what that initial practice was, what Hahnemann came to us with.
So commentary, I find value in what you're saying about stress, and how it affects
Yes.
everything.
Yeah.
And, people like to divide us, allopathic versus
Yes.
homeopathic. And there's a large segment of the allopaths that are now looking at integrative practices that incorporate some of the homeopathic principles. So stress in and of itself can affect an individual so adversely that it can create, there's a particular type of cardiomyopathy called, I'm going to butcher his name, Takotsubo cardiomyopathy, which is commonly known as broken heart syndrome. Have you dealt with anybody that?
I have.
Yeah, and so that is like once somebody has cardiomyopathy, we're told that it's irreversible. Except in this instance, where the stressor has been so great that it has pressured the heart so profoundly that they have symptoms of people that are in heart failure.
Right.
Until the stressor dissipates and until, appropriate treatment modalities have been utilized to help the person regain normal cardiovascular function. So, for my colleagues that would poo-poo this, I say we need to incorporate more homeopathy in how we practice.
I think it's important. And homeopathy was taught in our medical schools here until the American Medical Association went on a witch hunt. I mean, they burnt a school down. We had better outcomes in the 1918 flu. I mean, it was just part of medicine.
So the Hahnemann School in Philly, I think is where it is, the Hahnemann Medical School, named after Hahnemann, was actually a school of homeopathy until all of that started to
That's
happen.
right.
Which is, I think a lot of it boils down to who controls what.
It's profit.
And greed. Exactly.
Profit divides us, and our medical system is profit-driven, which is unethical.
Yeah.
It is unethical. In Germany, it is not profit-driven. So when the German doctors say, do this, people believe them.
Yeah.
But here, there's that profit underneath it all. And so what is for the good of the patient? Is the good of the patient the most valuable part of medicine, or is profit? In Europe, it's used. You can go to your MD in Germany, and they will give you a remedy along with the meds you need, the pharmaceutical meds. And that kind of approach, a holistic approach, is lacking, and it's a shame.
My people, the nurse practitioners of the world, right, kind of bridge that gap a little bit. And like I said, we see more and more now integrative practices happening in what is considered a traditional allopathic type of practice. And more patients are seeking those kinds of remedies now. Frequently, they'll come in and say, okay, I know I have these problems, but I don't want any drugs. What else do you have?
And sometimes we need the drugs,
And sometimes we need the drugs.
We do. And I work with clients on their meds, and we work fine, and it doesn't interfere with them. I don't think there's anything else. For example, my client with rheumatoid arthritis, we recently had a follow-up, and she said, hey, I have a question for you. Does this work on my kidney too? I said, yes, it's working on your whole body. What happened? And her kidney numbers are better. And we see that. We also see the opposite, where you have a client in a remedy state, and you have a client in a particular remedy state who was just diagnosed with Hashimoto's. And I said, well, great, your remedy has, the thyroid is in there. It's a big thyroid remedy. So we see that too, where your state is your state, and even other things that happen, are part of that. And, and I want to say on the reverse side, I have seen people go to functional medicine doctors and spend $8,000 and not be better. You know, and so it's not like the alternative world offers all of the fabulous answers to everything, and I think people have to be really careful about what they do, you know. Well, it's a business model. There's a business model, you know. Yeah.
I don't know if this is quantifiable, but I am curious when it comes to successful outcomes, how much is that due to this very elaborate, kind of like therapeutic relationship you have with a client? It seems almost like a form of talk therapy in a sort of sense, where you're getting to know the person. There's this patient-practitioner relationship. Like, how much healing actually comes just from opening up about one's life compared with the actual remedy itself? Or is that kind of, I'm curious what your thoughts are on that.
I cannot help anyone without giving them a remedy. I have had clients who don't want to take a remedy. I'm like, I can't work with you. I think it's not a therapeutic relationship, but it is a relationship of deep respect. And I think that helps. Sometimes I send clients to therapists if they need more. But I think the remedy does most of it. You know, I do. I think I'm a little, you know, I'm doing my little work, and I love my clients, and I pray for them, and I want them to succeed, but it is ultimately the remedy on themselves who are doing the healing. Yeah, thank you. Any other questions?
So, am I understanding correctly that, like, the entire time that you see a patient, you give them one remedy?
At a time.
At a time, okay.
So sometimes people change remedy states, but it's not that frequent.
Okay.
You know, sometimes with the children, like the children who are having a little deeper pathology, we see them cycle into a different remedy, but I'm giving one remedy, yeah. Your chiropractor will give you a blend of 6 remedies. I don't do any of that. That's the classical homeopathy, is that we are in one constitutional state, and that is the remedy that is going to inspire our vital force to heal us. Yeah,
Okay.
I know.
That has not been my experience with homeopathy.
Yeah.
I
Yeah, some people take lots of remedies at the same time. I mean, we have some good blends at Natural Grocers, right? Migraine things and allergy things. And when they come to me, I say, please put that in your cabinet and just let this work. But again, that's allopathic.
Right.
It's, you know, I've got the headache, I need a remedy for that instead of waiting. And sometimes clients are impatient. Like, oh, my hot flashes are not better yet. I'm like, okay. We're working on some childhood trauma right now. These things are getting better. And I don't know how long things take. I don't know. And then there's a moment where things click. And then clients really feel like they're in a different state. And they feel stronger. They feel sturdy, more sturdy. You know, and my husband's had a remedy. It took a while to get him to the homeopath. And the next day, because he's trained as a medic in the Coast Guard. And he was like, are you telling me there's something to it? You know, our son's had remedies since he was 6 months old, and I think it has helped him to just be his better self. Doesn't fix everything, but it helps a lot. Yeah. Any other questions?
have one more, I'm sorry.
Don't be sorry.
So, while people are kind of in that state of waiting for their remedy to like take hold and help with the problems that they have, do you recommend anything else to like help with like particular symptoms or anything?
I mean, if there's a medical issue and we need medicines or things like that, yeah, but I actually like it when people just do the remedy and not, some people are like, they come to me and then they want to do psilocybin and then they want to go get new med, and it just, we don't know. We have to let the remedy work.
Sure.
And so that's important for those early couple of months, just to let that remedy work. And people do see differences in the first few weeks, but those deep, long-lasting, you know, deeper healing mode, that takes a little bit longer, you know. And the older we are, or the longer we've had an illness, the longer it will take to unwind, but it does unwind. Yes. Okay, well, thank you so much, Jean, for having me today, and thank you for coming. Thank you very much. I have my card. If anyone wants to sign up for my newsletter,